Hello future nurses, my name is Eileen and for my video presentation today I'll be explaining how to perform a bilirubinometer on a newborn baby. First I'll explain the process and at the end I will demonstrate how to perform this test. There are several ways to perform this test, such as a transcutaneous bilirubinometer, which is the most common, or a serum bilirubin test. The reason transcutaneous bilirubinometer is most common is because it is a non-invasive way to track a newborn's bilirubin to differentiate between normal and abnormal levels based on their age by hour. The reason it is important to track their bilirubin is because in approximately 1/2 of all term newborn may develop a condition known as physiologic jaundice. Our job as nurses to document this bilirubin levels and report it to the healthcare providers. Serum bilirubin test is another way to test the bilirubin levels in the newborn. However, it is an invasive test and done when the transcutaneous device is showing abnormal levels on the newborn. What is bilirubin? Bilirubin is a yellowish pigmentation on the skin that is a product of broken down red blood cell. In a healthy adult, liver conjugate bilirubin so it can excrete in feces. However, in newborn, the liver is still immature. Therefore, the unconjugated bilirubin builds up in the blood and makes a yellowish appearance on the skin known as hyperbilirubinemia. As I mentioned earlier, this can lead to jaundice. Now that I have given a background of this condition, let's focus on how to use the device in a hospital settings on a newborn baby. Cleaning the port with an alcohol swab before using this device is very important to prevent hospital-acquired infection on a newborn. Remove the device from the charging unit and switch it on by holding the green power button. To check if the device is ready to use, a green light will be turned on top of the device as shown in this picture. On the side, there is a lock button. Press to unlock the device to get an accurate reading levels. It is a touchscreen device, so by touching the measure button and then selecting MG over DL to measure the levels if it has not been selected already. Before screening the measuring site, selecting the measuring site, such as the forehead or mid-sternum, make sure there is no bruise or excessive hair or any discoloration on the side. Place this jaundice meter probe flat against the baby's skin, not in an angle. This is the most important mistake most people can make, so carefully place it against their skin and press lightly until a click is heard or a red light is shown on the device. Make sure not to press it on the baby's eye because the lighting on the device is pretty intense. The measured bilirubin will be shown on the display. If the meter was set to take more than one measurement, lift the meter from the skin between measurements. Average results will be displayed and this value must be documented or plotted in the newborn bilirubin graph. After using the device, place it, or if a red light is shown on the device, make sure to put it back into the charging unit for the next person to use it. This graph can be overwhelming. However, as you record the bilirubin level based on how old they are at that time, it gets plotted itself. This graph shows the number of the transcutaneous bilirubin level in relation of how old the baby is. The higher the number, the higher the risk. But they can tolerate this high number the older they become. Now I will be demonstrating how to perform this transcutaneous bilirubin test, either on the forehead or on the mid-sternum. Thank you for taking the time to watch this video, and hopefully you learned something new